So we're going to talk about doing the NIH stroke scale the way that NIHSS does it. Not necessarily what you're going to see whenever you do the certification on Apex Innovations. So the first thing I want to talk about is setting up the room. So you see we have a sheet on the bed. With the paper that we have on these cots, it makes a lot of noise with the microphone. So when you place the microphone on the patient, preferably they like it in the patient's lap. Sometimes that's not feasible, but you want it as close to the patient's mouth as possible, because when they're having problems speaking, it's hard to pick that up. Also, you want the patient to kind of be sitting up. So when the neurologist is on the screen, the call center is on the screen, they can actually see the patient and the patient's face. You always want the bed rail on the opposite side of the bed to be up because it's a safety issue of them possibly rolling out of the bed. And the call center and the neurologist will call you out on it if it's not up. So always make sure that you do that. You also want to be on the patient's good side or the unaffected side, because you don't want to be on the side that's affected and then having to be looking around if that eye or something's not working on that side. So you want to make sure that you have the flip cards, is what these are called. And if you will go by these step by step, you're usually not going to miss anything. So it has the phone number on the front, and then the things that you need, like your labs, how many IVs, that type of stuff. So you always want your flip cards. You want the remote out of the Omnicell. You need your picture cards, is what these are called, and these are kept in the actual Tanberg here in the room. And then this is our stroke folder, or our safe folders, and these are kept in the protocol drawers out at the nurse's station. So this has all your paperwork, your intake sheets, consents, and all that. So you need one of these. And then you always need a pump in the room because if you're going to give the Activase or anything to treat the blood pressure, then you're going to need at least one pump. The Activase box, that's kept out at the nurse's station on top of the med refrigerator, so you'll be able to see that. So now we're going to do the NIH stroke scale. So the first question is the level of consciousness question. A lot of people make the mistake of asking the patient, can you do this? Can you tell me your name? Can you tell me what month it is? You don't want to do that. You want to be more of a command. You want to say, tell me what month we're in. Tell me what month we're in.
August.
Okay. And tell me your age.
45.
Okay. And then the next one is, you want to tell the patient to close their eyes. Open them. Okay. Make a fist for me and open it. Okay. These questions are to see if the patient understands what you're asking them to do. So that's why you don't want to ask them, can you do this? Because the answer to that question is going to be yes or no. And you don't want to show them. You don't want to make a fist in front of them. Because if you do that, you don't know whether the patient understood the command that you were giving them or if they were just mimicking what they saw. So you just tell them, tell me what month it is and how old you are. So the next one is the best gaze. So this is where you're going to want to zoom in, or if you have someone in here with you, another nurse, they can be using the remote to zoom in and out. So you want to zoom in where the neurologist can see the patient's eyes pretty well. If they have glasses on, you would want to take them off. So you want to tell the patient, I want you to follow my finger with your eyes only. Do not move your head. Okay? So we're going to go to this side of the bed first, back to the middle, and to my side of the bed, back to the middle. If you will do bed rail to bed rail, you'll get it. There is no up and down, there is no side to side. We simply want to know if the patient has a gaze palsy. So from this side to this side. Sometimes the patients want to move their head and they really don't understand what you're telling them to do. So it's okay to put your hand on their head to help prevent them from moving it, and then do the side to side. The next one is visual fields. And if you'll come around here to kind of see what I'm doing, that'll be better. So the best way to do this is you want to be about arm's length from the patient, okay? And you want their face or head to be about in the middle of the square here. So you're going to ask the patient to look at your nose, okay? I want you to look at my nose. I'm going to hold my hands about halfway between me and the patient, about the level of my eyes, and then about the level of my jaw. So this is all you have to do up and down, about halfway between you and the patient. So I want you to look at my nose. I'm going to hold up some fingers. Tell me how many fingers you see.
1, 2,
Look at my nose.
6,
Okay. Look at my nose.
2, 5, 10.
Very good. Okay. So for visual fields, you notice that I did something on one hand, something on this hand, and then on both hands. You want to see if the patient sees things on each hand and then whether or not they can add. If the patient cannot speak, if they can't tell you 1, 2, or 5, and that's the numbers we should use, we should not ever use 3 or 4 because they can be confusing. So you'd want to do 1, 2, or 5 on each hand and then one of those for both for them to add up. If they can't speak, then we would tell the patient, okay, I want you to look at my nose. I want you to point to the fingers that you see moving, and then you would wiggle your fingers, and then see if they point to each side and then point to both. And you would do that in the upper and lower fields. Okay? So that's visual fields. The next one is facial palsy. You want to zoom in to where the neurologist can see the patient's face very well, because they're looking for like nasolabial folds, weakness on one side. So you ask the patient to smile really big. I need you to smile for me. Show me your teeth. Smile, smile, smile. Okay. And I want you to raise your eyebrows really high. Okay, very good. And I want you to squeeze your eyes shut really tight. Squeeze, squeeze, squeeze. Okay, very good. So that's all you have to do for that one. The next one is motor. So you always want to start on the patient's unaffected side. We start with the arm. So we're going to have the patient hold their arm straight out. We want their palm down and their fingers straight out. That way the neurologist can see the patient, or the droop if they have one. So we're going to hold this up for 10 seconds. Don't let it fall. 1, 1,000, 2, 1,000. I'm not going to count to 10, but we would count 1, 1,000 up to 10 and then put it down. Same thing on this side. 1, 1,000, 2, 1,000 up to 10 and put it down. So if the patient holds their arm up and it falls immediately, you try it one more time. So we would have them hold it back up. If it falls again, then you ask the patient, can you move that arm at all? Can you shrug your shoulder, move your shoulder? If they can't shrug their shoulder or move at all, then you're going to do painful stimuli. So we would take an ink pen, and on the nail bed of one of their fingers, you're going to apply pressure to see if they feel that pain and see if they can move their arm back. So once we do that on both arms, we go to the legs. So it's always better to lay the patient back a little bit because it's hard to raise your leg up if you're in a seated position. So just like we did the arms, we raise the leg, but we only do it for 5 seconds. So you have them hold it up, 1, 1,000, 2, 1,000, 3, 1,000, up to 5. Same on this, 1, 1,000, 2, 1,000, up to 5. So again, if they drop their leg immediately, you ask them to do it one more time. If they can't, ask them if they can move their leg at all. And if they can't do that, you take the ink pen and you do the nail bed on the big toe. Sometimes the doctor or neurologist will ask you to do a Babinski reflex. So take an ink pen or the blunt part of your shears, if you have shears, and kind of run it up the patient's foot. Also, the patient needs to have their shoes off during the exam. So we do both legs there. And then I like to sit the patient back up. So that's arm and leg. Now we do ataxia.